my name is Olivia and I'm going to be your student nurse today. And today I'm just going to do a head to toe physical assessment.
Okay.
So I'm going to start off with washing my hands, and then I'm going to provide privacy. All right, and what brings you in here today?
I just have a scratchy throat.
Okay, all right, we'll look into that. And then if you would, verify your name and birthday for me.
Sterling Freeman, 12/09/1998.
Perfect. And then do you know where you are?
Howard College.
And what city you're in?
Big Spring, Texas.
And what year it is?
2019.
All right, perfect. I'm going to start off with taking your vitals. So I'm going to get your blood pressure. Do you have an arm that you prefer?
No, ma'am.
Okay. We're going to do your right arm. All right, your blood pressure was 124/70. And now I'm going to do your temperature and your O2 sats and your pulse. So we're going to start off with this. This one. All right, you have 98.7. Alright, now I'm going to put this on your finger. Alright, and then I'm going to do the pulse over here as well. Alright, looks like your O2 sats are 98 and your pulse is 100. Okay. Now I'm going to get started on the head, ears, nose, and throat.
Okay.
So I'm first going to inspect your head. Are we having any headaches or lesions that you're concerned about?
No, ma'am.
Okay. Now I'm going to look into your ears. Like that. We'll pull it back. Look into it. Alright, are you having any pain, drainage, or anything like that?
No.
Okay, pulling it back. Okay, and now I'm going to do cranial nerve number 8. So what I would like for you to do is maybe close your right ear, and then I'm going to whisper 3 words behind you and just identify what I'm saying.
Okay.
Oops.
Whiteboard, clock, book.
Okay, now close your other ear. I'm going to whisper 3 words again.
Wash, Barbie, Kleenex.
All right, perfect. Now I'm going to look into your nose. So if you would lift up just a little bit, I'm just going to insert just a tiny bit. Okay, and now I'm going to do cranial nerve number 1. So if you would, close your eyes. And then I'm going to put something under your nose, and you're going to identify what you smell. Get this out.
Alcohol.
All right. Now I'm going to inspect your eyes. So I would dim the lights, and I would like for you to look at that clock over there, and don't look into the light, okay? All right, perfect. And so now I'm going to check cranial nerves 2, 3, 4, and 6. So if you would read the second line of this.
874.
All right. And now if you would follow this pen, and then without moving your head, just follow it with your eyes. very good. And now I'm going to check your throat. So this is also cranial nerve 9, 10, and 12.
Okay.
So if you would stick out your tongue and just say "ah" for me. All right, checking gag reflex as well. And then if you would wiggle your tongue for me. All right, perfect. And now I'm going to check cranial nerves 5 and 7. So if you would give me a huge smile. All right, wiggle your eyebrows, close your eyes really tight, make the blowfish face. All right, perfect. And so now I'm going to do this. So this is soft, and this is sharp. So I'd like for you to close your eyes and then identify what you feel.
Soft. Sharp. Soft. Sharp. Sharp.
Perfect. All right, now I'm going to inspect your lymph nodes. All right, is there any soreness of what I'm doing? Is this painful? All right, it's right here as well. All right, and I'm just gonna come behind you. All right, if you would swallow for me. All right, perfect. And then I'm gonna go ahead and check cranial nerve 11. So I'm gonna put my hands on your shoulders, so if you would resist. There you go. I'll put it here and go against it. All right, perfect. So now I'm going to check your respirations. And so I'm going to move the camera. All right, and then I'm going to come over here. I'll move your hair just a little bit. All right, I want to first inspect. Is there any pain or lesions or anything like that?
No, ma'am.
All right, now I'm going to percuss. Let me know if any of this feels sore. All right, and if you take a deep breath for me. All right, and now I'm just going to do this. Let me know if this hurts, okay? All right, now I'm going to check your respirations. Take a deep breath for me. Again. When it comes to the front. All right, you still see me. All right, I'm just gonna basically do the same thing. Okay, so deep breath. All right, just coming under the breast a little bit. All right, so now I'm going to check your carotid artery. So if you would take a deep breath and hold it. All right, release, and then do it again, please. Okay, and so now I'm going to check your heart. I'll start with aortic, pulmonic, Erb's point, tricuspid, and then under here, your mitral valve. All right, so if you would lay down for me, please. Okay, just going to check your heart again. So aortic, pulmonic, Erb's point, tricuspid valve, and your mitral valve. All right, perfect. And then if you would lift up your neck a little bit, I'm just going to check for JVD. All right, perfect. Now I'm just going to inspect your arms, make sure there's not any edema or swelling, and then I'm going to check your brachial pulse. Okay. going to check your radial pulse. All right, now I'm going to check for clubbing and the cap refill. All right, now I'm just going to make sure that your legs are good, not swollen. Now check your pedal pulse. Here, let me back this up just a little bit. All right, your pedal pulse. All right, and then cap refills as well. All right, perfect. And then if you would put your arms to the side, I'm now going to check your abdomen. So I'm first going to check on eye level. All right, thank you. Sorry. Oh, you're good. Belly button ring. I'm just going to move this out just a tiny bit so it won't get caught. All right, now I'm going to osculate. Okay, now I'm going to percuss. So let me know if any of this feels tender, okay? All right, now I'm going to palpate. I'm just going to do it lightly. Let me know if any of this hurts. All right, and this is not painful? All right, so now I'm just going to go a little bit deeper. Let me know if this still hurts or if it does. Okay, perfect. And then you can sit up. All right, and I'm just going to move the camera again. Alright, so now I'm going to check your reflexes. So if you would lift your, don't lift, put your chin to your chest and then lift it up and go as far as back as you can. Alright, now go to as far as the right and to the left as far as you can. Okay, perfect. And then if you would lift up your arms like this and then wiggle your wrists, and if you would just resist. Alright, perfect. And now I'm just going to check your triceps reflex. So if you would just relax for me. Okay, I'm going to do this other one. Just relax. There you go. Now I'm just going to do the biceps one. Okay, now I'm just going to do brachial radialis. Okay, do the other side. All right, now I'm going to check your knee. So if you would just go back a little bit so that your feet are kind of hanging. Okay, now I'm going to check your Achilles. Other side here. Okay, and then if you would just like press against my hand. All right, and then lift up. Okay, now I'm just going to check Babinski. Okay. All right, perfect. Now if you would lift up your legs, all right, wiggle your ankles, perfect, and if you would stand up for me, please. All right, now if you would just touch your toes, I'm just going to feel your spine. Okay, and then if you would just close your eyes and stand still for a second. All right, and then if you would put your hands on your hips and just shake it like that. All right, now if you would, just walk towards me, heel to toe. All right, perfect. You can go back to the bed. All right, if you want to sit down. All right, do you have any other questions or concerns?
No, ma'am.
All right, I'm just going to wash my hands again. And then if you need anything, just let me know and I'm going to go see the doctor, okay?
Hi, my name is Brooke. I'm going to be your student nurse today. I'm going to be giving you a quick head-to-toe assessment. It should take about 20 minutes. Can you tell me your name?
Elena,
You know where we are,
the nursing building,
and you know what day it is?
April 28th.
I see that you're alert and oriented ×3. By looking at your general appearance, I see that you are well-groomed. I don't see any medical devices like crutches, canes, or glasses. Do you have any internal medical devices like a pacemaker?
No.
All right, so no medical devices. I see that you have no labored breathing, bleeding, vomiting, diaphoresis, activities of seizure or expressions of pain. I see that you're speaking clearly, articulating your words well, and you are cooperating. So now I'm just going to start by inspecting your head. So I see that an absence of trauma, your head is symmetrical and even bilaterally. I see that your hair distribution is even and equal bilaterally on your head. Do you feel any maxillary sinus tenderness?
No.
Any frontal sinus tenderness?
No.
All right. Now I'm going to be looking at your pupils with my pen light. So I'm just going to shine this on your eye. And on the other side. I see that your pupils are even and round, reactive to light and accommodation. So now I'm going to ask that you follow my finger with your eyes. Try not to move your head. Alright, that tells me that cranial nerves 3, 4, and 6 are intact. If you could cover your left ear for me, I'm going to stand behind you and whisper a word, and if you'll just repeat it back to me.
Chicken tenders.
And we're going to do it on the other side.
Macaroni and cheese.
Alright, that tells me that cranial nerve 8 is intact. If you could smile for me with your teeth, frown, and puff your cheeks. That tells me that cranial nerve 7 is intact. I see that your nose is symmetrical and even equal bilaterally. If you could cover one nostril and then breathe out of the other one. And then again on the other side. I see that your nostrils are patent. Now I'm going to be looking in your mouth with my pen light. I see that your oral mucosa is pink wet. I didn't see any lesions. I did see that your tonsils are present on a 1+ out of 4 scale. You could stick your tongue out for me and say ah. I see that your uvula raises on phonation and your soft palate elevates midline, and I also saw that your tongue protrudes midline. So that tells me that cranial nerves 12 is intact by looking at your tongue. And then with the phonation and soft palate, that tells me that cranial nerves 9 and 10 are intact. Now I'm going to look at your jaw. I'm going to place my fingers right here, and if you'll open and close for me. I don't feel any crepitus, don't hear any popping sounds, so no signs of TMJ. And I'm going to feel your carotid arteries on the sides of your neck. It's 2+ out of 4, even and equal bilaterally. Now I'm going to listen with the bow of my stethoscope for bruits on your carotid artery. Alrighty. No signs of bruise, equal bilaterally. Now I'm just going to feel your supraclavicular lymph nodes right above your clavicle. Do you feel any tenderness?
No.
I don't feel any enlargement. Alright. Okay, now by looking at your skin, I see that it is pink. It's equal over all extremities, normal for your cultural background. I see that your hair distribution on your arms is even and equal bilaterally. See that the hair on your legs is shaved equal bilaterally. Now I'm going to use the back of my hand to check your temperature, your arms and legs. I see that your arms are smooth, dry, warm, equal bilaterally, and your legs are also smooth and dry and warm, equal bilaterally. I'm going to check your skin turgor just by pinching your skin right here. I see instant recoil, and I'm going to check your cap refill on your fingers, so if you will spread your hands out for me. Your cap refill is less than 2 seconds on your fingers, equal bilaterally. Now I'm going to do your toes. And while I'm down here, I'm just going to check for edema on the top of your foot, on your shins, and on the back of your ankle. Alright, I see no edema present. I'm going to go ahead and check your dorsalis pedis pulse. And then your posterior tibial pulse. Both of those were 2+ out of 4, even and equal bilaterally. I'm gonna use some more hand sanitizer really quick. Takes a little bit to dry. Alright, now I'm going to listen to your heart sounds. First, I'm going to be using the diaphragm, which is this big part, and this is for high-pitched sounds. So I'm going to start right sternal border, second intercostal space. And then I'm going to move to right sternal border, second intercostal space. This is your pulmonic area. What I listened to first was your aortic area. And now I'm going to drop down to left sternal border, third intercostal space, and this is Erb's point. And I'm just going to come up underneath your shirt. And then this fourth intercostal space, left sternal border. This is tricuspid area. And then I'm going to move mid-clavicular line in this fifth intercostal space. And this is the mitral area. I hear clear S1, S2 sounds with no adventitious sounds or murmurs or clicks. And then I'm just going to do the same thing with the bell of my stethoscope, which is going to be for low-pitched sounds. Starting in that aortic space again. Pulmonic. Erb's point. Tricuspid area. And this mitral area. No bruise. Again, just clear S1, S2 sounds. No extra hard sounds, murmurs, or clicks. Now I'm going to be looking at your chest while you breathe. I see that it raises symmetrically, even and equal bilaterally. I see that you're not using any accessory muscles when you breathe. And now I'm just going to be listening to 6 spots on the front of your chest for your breath sounds. If you would take a deep breath in and out for me each time I place my stethoscope. I'm going to come up underneath on this side. And if you would turn and face this way for me, and I'm going to listen to 8 spots on the back. Going to come up underneath your shirt. Alrighty, I hear no adventitious sounds over all lung fields on the front and the back of your chest. Now I'm just going to be assessing some pulses. So I'm going to start with your brachial pulse, which is in your elbow. Alright, and on the other side. I see 2 plus out of 4 equal bilaterally. Now I'm going to move to your radial pulse, which is in your wrist. Actually, I'm going to move this. And another one. 2 plus out of 4 equal bilaterally. If you would lay down for me, please. And I'm going to be feeling in your groin area for some femoral pulses. Two plus out of 4 equal bilaterally. And now I'm going to feel for some inguinal lymph nodes. Do you feel any tenderness?
No.
No enlargement. And now if you would kind of bring your knee up to your chest, I'm going to feel your popliteal pulse. Now drop all the weight on your foot. And then again, we're going to do this on the other side. Lift your knee up, drop your weight. Now I don't feel your popliteal pulse, but in this situation, I'd go get another nurse to help me. And if you would, go ahead and sit up for me. I'm going to raise this back to a 30 to 45 degree angle. And if you'll lay back for me, I'm going to use my pen light. And if you would, look to the right side for me. I'm just looking for your veins. I see that it's flat, so no JVD on this side. And then we're going to move to the other side. Again, flat, no signs of JVD. If you would, go ahead and sit up for me. Just inspecting to make sure I'm hitting all the points for you. Alright, we're going to go ahead and we're going to lay all the way back again. Alright, and I'm going to lift up your shirt. We're going to be looking at your abdomen. I see no lesions or masses. Again, your skin color, I don't see any cyanosis, pallor, rubor, or jaundice. I see that the contour is flat. And first, I'm going to be listening with my stethoscope for your bowel sounds with my diaphragm. Going to be listening in 4 quadrants, right upper and lower, and then left upper and lower quadrants. Vital signs are present in all quadrants. And now I'm going to be doing a percussion, which is just me tapping on my finger in each quadrant. I hear tympani in all quadrants. And now I'm going to be doing just a light rub on your stomach in each quadrant. I'm going to start in the right upper quadrant, and then this is where your liver and gallbladder is. And then this right lower quadrant, this is where your ascending colon is and your appendix. And then this left lower quadrant, this is where your sigmoid colon is. And then the left upper quadrant, this is where your stomach, spleen, and pancreas is. I don't feel any masses. See no deformities again. I felt no resistance. Did you feel any tenderness?
No.
No? Alrighty. If you will, go ahead and sit up for me again. Actually, I lied. I'm gonna have you lay back down. So sorry. I'm gonna raise your shirt again. I forgot to listen for bruise. We just want to check your arteries. But I'm gonna be doing this with the bell of my stethoscope. So we're gonna start with your aortic artery. And then your renal arteries on both sides. And your ischial arteries. Alright, I don't hear any bruise. Equal bilaterally. And now for real this time I need you to sit up. Just by looking at your neck, I don't see any swelling or deformities equal bilaterally. On your arms, I don't see any swelling or deformities equal bilaterally. Now, if you would squeeze my fingers, I see 5 out of 5 strength. And I see no swelling or deformities on your legs equal bilaterally. Now, if you would show me your big biceps. All right, you can go ahead and put that arm down. If you would push against my arm. All right, and then pull on my arm. Okay. 5 out of 5 strength against resistance on that side. And then again, push. Alright, and then pull. Alright, 5 out of 5 strength against resistance on your upper extremities, equal bilaterally. If you would, lay down for me. And then if you would kind of raise your knee to your chest again, you can go ahead and lay this leg flat for me. And then lift this one up. And if you would, push against my arm. All right, and then, yep, you know the deal. 5 out of 5 strength against resistance on this side. And we're gonna do it again on the other side. So if you would push, and then pull. All right, 5 out of 5 strength against resistance. You can go ahead and sit up for me. Now I'm gonna think about what I have inspected and make sure I'm not missing anything. If you would, stand up for me, please. All right, and if you would look that way. And I'm just gonna point out your pressure points. Your occiput, which is like around your occipital lobe, your shoulders, scapula, sacrum, trochanters, your ischial tuberosities are around here, your medial knee and lateral knee, medial malleolus, and then lateral malleolus, and then your heels. All right, I'm gonna use some hand sanitizer, and that's gonna wrap up our head to toe assessment.